Hello, everybody. Welcome to today's conversation. We're so excited to be here with you all. My name is Gabriela Barbosa. I'm the Managing Director of Policy at the Children's Partnership. We are a statewide children's advocacy organization dedicated to advancing child health equity through public policy, research, community engagement. We are so excited to be here with you all today. Welcome to our community conversation that the Children's Partnership is hosting, along with the California Black Health Network, the California Black Women's Health Project, and the UC San Francisco Preterm Birth Initiative in celebration of Black Maternal Health Week, with 5 incredible leaders in Black children's health and maternal health movements. Thank you so much to our speakers for joining us, and also thank you to the Black Mamas Matter Alliance for starting the Black Maternal Health Week back in 2018. We're so excited to be here with you all today in conversation to center the health and well-being of Black birthing people, mothers, and infants during Black Maternal Health Week. Last February, the Children's Partnership released a data snapshot in partnership with the California Black Women's Health Project and the California Black Health Network that centers the health and well-being of Black children in our state. Today's discussion will explore the ways racism shapes and perpetuates challenges among Black infants and birthing people, and highlight the incredible work our speakers are doing and the power of Black communities to lead the push for change. As we engage in today's discussion, I encourage you all to drop in questions in Twitter, Facebook, LinkedIn, and wherever you're catching today's conversation from. All right, with that, I would like to begin by asking each speaker to take a minute to introduce themselves and their work supporting Black families and communities. I'll start with you, Rhonda.
Great. Thank you very much, Gabriela, for the invitation and the opportunity to be here today. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and we are the only Black-led statewide organization that advocates for advancing health equity for Black Californians. That includes African Americans as well as Black immigrants. And we do outreach, education, policy, and advocacy work to make all that happen.
Thank you so much, Rhonda. I'll pass it to you, Raina.
Good afternoon. I'm Raina Granberry. I'm the Senior Manager of Maternal and Reproductive Health at the California Black Women's Health Project. And we concern ourselves with the health of Black women and girls across California in all parts of their journey from pre-conception to aging. And so we're happy to be here today.
Thank you so much, Raina. I'll pass it to you, Alexis.
Hello, everyone. My name is Alexis Cobbins. I'm the Executive Director of the California Preterm Birth Initiative, where we do research to improve birth outcomes for Black birthing people and their infants. We do this through community engaged research and recognizing racism as a root cause of the disparities that we face. And I won't tell it all. I'll leave some for my colleague, Solaire, who's going to introduce herself next to tell.
Please go ahead, Solaire.
Thank you. Hi, everybody. My name is Solaire Spellin. I'm the Associate Director of the California Preterm Birth Initiative at UCSF. I sit on the executive leadership team with Alexis. I'm also a co-founder of the California Coalition for Black Birth Justice. My background's in maternal health research, collective impact, and developing birth equity research strategies that are grounded in health equity, anti-racism, and also community partner practices. And so at PTBI, we make sure we spread that to others so that they're able to do the same. Really excited to be here with you all. Thank you.
Thank you so much, Solaire, and thank you to all of our speakers for being here with us today. We also have Assembly member Mia Bonta, who's scheduled to join us, and so we'll let her introduce herself when she joins this conversation. But I would love for us to get started with this first question. What does a California where Black mothers and birthing people have everything that they need to have a sacred and beautiful, joyous and healthy birth look like? And actually, before starting with that question, I see that the Assembly member has joined us. Assembly member Bonta, are you here with us? All right, I will give her a few moments to join our conversation. But going back to this question, what does a California where Black mothers and birthing people have everything they need to have a sacred and beautiful, joyous, and healthy birth look like? Rhonda, can we start with you? Oh, Rhonda, I can't hear you. I'm not sure if others are having that
Oh,
issue.
sorry, it's accidentally. Sorry, I was on mute. So I think for that to happen here in California, I think it takes policies. It takes healthcare providers to make sure that they are caring for our Black birthing people in the right way and in an equitable way. I think it takes the community. We see there's a lot more opportunities to include and incorporate doula support into the birthing journey and process and experience for Black women. So happy to see there's more support as part of the healthcare system for that. I know that the other women here have a lot more to say, and I know we're waiting for Assemblymember Bonta to join, but just wanted to say those few words.
Thank you so much. Appreciate that. Raina, would love to hear from you. What does a California where Black mothers and birthing people have everything they need to have a beautiful and joyous, healthy birth look like to you?
I think that there is a system overhaul needed and just a big community investment, respect for our ancestral and community defined practices. Folks would be able to have access to birth centers and midwives and people who don't have, racist or biased beliefs about their pain or their abilities or their knowledge of their own bodies. And I also believe that, everyone will be able to have, their environmental harms that also impact us. There are educational harms that impact us. So there will be all of these steps to eradicate the racism in all of the places that affect our health in order for Black women, families, and birthing folks to have the experiences they need.
Thank you so much, Raina. And Assembly Member Bonta, thank you so much for joining us. I would love to pass it to you now. We just started with our opening question about what a California looks like that that ensures that all Black birthing people and mothers have a safe and joyous and beautiful and healthy birth. And would love to pass it to you to just give some opening remarks as we celebrate Black Maternal Health Week.
Thank you. I think it's wonderful that we get to do this at a time when we need to make sure that our health overall is centered right now. And I know that it's an important awareness month for you all. I get to join you from AD18, being the Assembly member for Oakland, Alameda, and Emeryville right now. And so pleased to be able to lift up the importance of Black children's health and Black maternal health in particular, particularly for me as a Black Latina mother of three who went through three different kind of experiences for the children that I birthed, and also somebody who had an abortion and who had 3 miscarriages as a part of my overall maternal and reproductive health story, something that we need to be able to focus in on, and I feel very passionate about. And I very much appreciate as well that you are not only centering Black maternal health, but you're also really trying to get at some of the systemic racism and issues that impact so immensely the lives of Black mothers and children, whether that be housing insecurity, lack of access to healthy food, or lack of access to childcare and educational opportunities, because that is also a part of our experience as Black mothers. And as I legislate, making sure to focus on community-defined protective factors and what we can do to address and acknowledge the impacts of systemic racism, some of the things that I've been able to focus on in this legislative cycle are one really around making sure that we have privacy protections for full reproductive health access, and a part of that journey and experience for us to make sure that we have the ability to have full access to reproductive care, particularly now in our post-Roe era. That's particularly important. As well, I have a focus on food insecurity with a bill, AB 1644, which will focus on food as medicine, making sure that we're lifting up an opportunity to have supported food and nutrition services covered fully by Medi-Cal, which is not the case right now. So people who are eligible for Medi-Cal do not have the ability to make sure that they are filling their bodies and sustaining themselves with food and nutrition that will ensure that we have overall health, given that we have such a higher incidence as a Black community in particular, related to food and nutrition issues overall, and the attendant factors that come into our overall health related to cardiac incidents, related to cancer, related to all those things that really come down to what we are putting into our bodies to be able to sustain ourselves. So that's really important for me. The other is just more holistically how we are treating and thinking about how we're helping to raise our children within a supportive environment. And I have a bill, It Takes a Village, which is AB 1321, which really centers the fact that we don't exist in a bubble, mother and child, but we exist really in a network of support of an extended family and systems of support that are intended to be with us from the time our child is born to the child that they move on to the careers to be able to thrive in their own lives. So AB 1321 really establishes a framework for a 3-year grant program, which will allow us to be able to have a cradle to career mindset in place-based ways for all of our children throughout the state. And that's something that is near and dear to my heart, given the work that I've done as the former CEO of Oakland Promise, which was a cradle to career initiative as well. So again, some of the things that I'm deeply passionate about and will continue to focus on are how we are ensuring that we have for our children early child care education at the center, ensuring that we have opportunities to provide flexibility of the way that our systems in early child care are really focused on what our parents need, what we need as mothers, what we need overall in supporting our early child care community, because we know so many things for our children come down to what their first 5 years of life look like in terms of their overall health, their overall access to educational opportunity, in terms of how their brains are developing and what they're able to do, their overall access to access to language and access to being able to be read to and loved, and developing those early literacy skills as well. So this issue around ensuring that our mothers are incredibly healthy in our bodies, in our access to reproductive care, in the way that we are able to sustain our bodies through healthy opportunity and healthy choices, but also what we are doing to ensure that our children, particularly in their early years, are brought into a loving, full community and in a supportive community that really gives them every kind of aspect that they need, whether that be health opportunities, educational opportunities, social services, and then ultimately that we have a thriving early child care system that is really making sure that we're reducing the stressors that happen for us in our lives as we're trying to mother, because our children and work and do all and take care of others, and all the things that we do, that we have an opportunity to address that are really at the center of what I am focusing on this year. So it's really a pleasure to be able to join you all, and very thankful that you are centering and lifting up the impacts of systemic racism on our bodies, on our opportunity for reproductive care and justice, on our opportunity to be able to raise and lift up our children so that they are put on the best path for the support that they know, that we know that they need in order to be able to thrive and be their full selves in their lives. So thank you.
Thank you so much, Assembly Member, for all of the incredible work that you're doing at the state level to address systemic racism. Before you leave us, I know you have to leave us pretty soon, but I'd love to ask you just one more question. And I'd love to hear more about your advice to listeners and other folks, advocates, community members who want to lift up community-defined practices at the state level and support the kinds of efforts that you're talking about. How can they support those efforts? What are the kinds of things that they can do? What is your advice to those folks?
I imagine that I'm speaking into a room full of practitioners, people who dedicate their time and energy on a daily basis to impact the life of one person or one community, a set of community members, and who have their heads down all the time, trying to do right by others and doing the work of service. And I would encourage you now to really take the moment and opportunity to lift up your heads and put on your best advocacy hats. And in your experience, your very particular set of expertise that is undeniable, you all need to be centered in the work that you are doing, because you are working, you are yourselves, we are ourselves, Black women, women of color, who are entering and supporting the space. You are yourselves experts. We are ourselves experts in our own lived experience. And then thirdly, you are the folks who are on the ground, knowing exactly where the systems are failing our Black mothers and our Black children especially. So I would encourage you to use the power of your voice and your language and your expertise in those areas, and make sure that your legislators, who don't all look like me, unfortunately, and who don't come from the same kind of experience that we would want our legislators to have, really make sure that your stories are shared to everyone. And when you get told no to somebody who is not willing to speak with you because they don't believe that you are representative of their constituents, make sure that they get put on blast about it, to be quite honest. Like, take that power that we have to use the voice that you have to make sure that our stories are being told to legislators and decision makers in a way that will enable us to make sure that we have the kind of change that we need in order to make sure that our communities are thriving.
Thank you so much, Assemblymember, for joining us in today's conversation. We're going to keep moving forward with our conversation, so please feel free to leave and take care of the amount of business that you have to take care of today with all the committee hearings going on. Again, thank you so much.
Thank you.
Of course. I'd love to now go back to our conversation around what a California where Black mothers and birthing people and infants have everything that they need to have a sacred, joyous, and beautiful birth. What does that California look like? Rhonda and Raina, you already answered this question. I would love to pass it to Alexis. I'd love to hear from you now, hearing from Assemblymember Bonta, who described some of the efforts that she's leading around creating this kind of California. We'd love to hear your thoughts on what's needed for California, where all people have everything that they need to have a sacred, joyous, and beautiful birth.
Sure, I definitely want to uplift what Rhonda and Raina already shared in terms of needing systems overhaul, policies, access to home births, all of those things. And in addition to that, I think, respecting Black birthing people, that they are the experts in their own experience, listening to them, valuing that there's more than one way of knowing, and giving them full autonomy in their birthing decisions. I think that's what it takes, instead of us thinking that we know what's best for others, valuing that they know what's best for themselves, honoring and respecting that, and listening to them.
Thank you so much. And Solaire, would love to hear from you before we move on to our next question.
Yeah, of course. I mean, just echoing what's already been shared, it really does look like having options, and also knowing that someone's got your back. I'll talk a little bit more about the Coalition for Black Birth Justice later, but we all share a vision, and we hope to witness a California that invests in Black women's leadership, our innovation, our collaboration, in order to move the needle. Because when you pour into those that are most impacted by an issue, it leads to better solutions, better outcomes, and better experiences overall. Like Assemblymember Bonta said, we have the lived experience, we have the expertise that's really needed to make meaningful change.
Thank you so much. So now moving our conversation, So today I would love to focus on two things. First, really talking about the ways that systemic racism continues to shape maternal infant health outcomes, specifically for Black communities, but also talking about solutions, and both policy solutions, but also everybody mentioned the power of community. So I also want to get to speaking about community solutions to advance health equity, specifically for Black birthing people, mothers, and infants. But starting to how systemic racism continues to shape outcomes around health and well-being for Black communities. This question is, what do you see as the biggest obstacles in eradicating and dismantling racism and its impacts on achieving health equity for California's Black mothers, birthing people, and infants? And Rhonda, I would love to start with you.
I was just thinking that is a huge question. So removing the obstacles. So, we're talking about, our country being founded on principles of racism. So we're talking about 400 years of undoing of all of that. But specifically here in California, again, there has been more legislation probably, I think, in most other states as it relates to the birthing space or perinatal space. And so with legislation and policies like SB 464, addressing implicit bias in perinatal health care, I think that's a great start. It's not the silver bullet that's going to dismantle racism here, but I think you have to start somewhere. And if people are aware of the bias that they impart on other people who may not look like them or come from different places than they do, I think being aware is the beginning. But I think instituting policies, education, being more aware, and taking ownership in how we view other people in the context of ourselves, what stereotypes there are in terms of what people believe about certain other people. I think addressing all those issues within healthcare is definitely important. And even going back to, looking at medical school, the medical school curriculum, and trying to eliminate, if we can, and if that's possible, the practices and teachings in the medical school curriculum that leads to that implicit or racial bias when those physicians are actually in a clinical setting and in practice. So.
Thank you, Rhonda. And Alexis, moving to you, a similar question, slightly different framing, but the snapshot that I mentioned earlier that we released in February highlights inequities in various social drivers of health that still are impacting the health and well-being of Black communities in our state. How does racism shape those social drivers of health, like access to stable housing and healthy food? And how does that create and perpetuate health inequities among California's Black mothers, birthing people, and infants?
Well, I'd just like to, first kind of ground us in the fact that racism is really this spectrum that goes from anti-Blackness to white supremacy, and your experience in this country is based on where you lie on that spectrum. And so it places value on one end and it devalues the other end. And because Blackness is devalued here, there's no positive investment or resource being placed in our community. We're not thought about. Our unique needs are neglected. And all those impacts are interconnected. So that's why you have economic inequality is persisting. Food deserts are existing. Our names, our skin color stops us from getting callbacks from jobs. It's this continuous cycle. So one thing impacts everything else. And then Black mothers and infants are not treated with any type of care or concern when we're going into these spaces to birth. And then it gets worse if you don't show up to give birth, giving off the identity that people think you should have, or you're not looking the way they think you should look, right? And so we're dying because we don't fit societal ideals or the norm. And it's set up that way, right? And so you go in places, people are treating you a certain way because you're Black. So you choose not to go, and then the fingers pointing at you. Oh, they're not. It's because of this, because they're not showing up, rather than looking at like, how do we make this more accessible, or how do we respect and value Blackness? And so I think it just keeps us in this continuous cycle where we keep putting the onus on Black people and not looking at our systems and structures, which is why I'm super excited about policy conversations, because that's where we start to turn the mirror back to where it needs to go.
Thank you so much, Alexis. And now turning to you, Solaire, highlighting some specific data that we saw in this snapshot. So the snapshot highlights how 74% of 1-year-olds who are Black and 81% of 2-year-olds who are Black and are enrolled in Medi-Cal are not actually accessing or receiving the preventive services like child visits, vaccinations, screenings, all of those things that are so important to a child's health, especially in their youngest years. I would love to hear from you your thoughts on why in these discussions around systemic racism, it's also important to center and include a focus on babies, infants, and toddlers.
Yeah, I think, one of the biggest obstacles that we see in this work when we're trying to achieve health equity in this space is the lack of specifically focusing on
Solaire, I think we lost you for 10 to 15 seconds. If you could,
can you hear me now?
We can hear you now.
Okay, great. I don't know where I left off, but I was talking about not us as a field not really addressing structural racism as the root cause of racial health disparities that we see. I think the intention is there, but we're not having an impact because we're not sure how to really do it well. That is why we're continuing to see the statistics, we're continuing to see the data. It is worsening because we are not taking this specific approach. And my colleagues and I developed the Racism as a Root Cause approach, or RRC for short, which is essentially a framework for developing strategies, policies, mechanisms that will really address the root causes of health disparities. And it has 4 principles that really serve as a guide. They help to structure this important work really well to dismantle racism. And so an intervention that has an RRC approach will have a precise impact on a specific group or groups. It's not going to be a universal one-size-fits-all approach. It's going to have a systems change component and work to change policies, systems, and environments. Like we've all been saying, that's really going to be the way to turn the needle, as opposed to trying to change people. There's nothing wrong with Black people. We need to investigate the environment and the systems that we're within in order to see a change. And it'll also have an aspect of reparations, and it'll be long-term. And I think a really good example of an RRC intervention that does not put the onus on Black birthing people and mamas, it recognizes structural racism, and was co-created with community, is Expecting Justice's Abundant Birth Project, or ABP, which is a pregnancy income supplement program that provides Black and Pacific Islander pregnant people with $1,000 per month during pregnancy and up to 6 months postpartum. And the idea is that this unconditional cash during pregnancy can alleviate some of the stressors that are frankly always present in the Black community, like economic inequities, insecure food and housing, well-being, et cetera. We brought these up already. And there are no strings attached, which is better able to set those families and those children, those babies, up for success on their own terms. So bringing that autonomy back into it. And so for those who are more interested, please look into it, the Abundant Birth Project. The pilot was launched in San Francisco and was recently funded to expand in several California counties within the next year.
Thank you so much for that. And we'll definitely come back to discussing these solutions in more depth in just a little bit in our conversation. But before we move on to talking about solutions, Raina, I wanted to ask you one last question that also speaks to the ways that systemic racism shapes health and well-being for Black communities. But mental health has come up as a huge area where there needs to be a focus, especially within the context of systemic racism and the way that racism also shapes mental health impacts. Raina, can you talk to us a little bit about the importance of maternal mental health in discussing these issues around health equity and systemic racism?
Absolutely. And then I think we can begin at a place where mental health is looked at in a very, there's not a broad spectrum of what mental health services can be as far as investment. And so I think one thing, we talk about community defined practices, and mental health needs to be approached that way, especially for Black folks. We are large proponents of therapy and clinicians when it comes to mental health, but there are a lot of other steps that get people to that point. So, there's very little investment in things like, something that California Black Women's Health Project does a lot, like sister circles, brother circles, somatic healing, things that have been done in the community forever. People go to church, they pray, they lift their hands, they clap. Those are things that are healing to us, dancing and all these different things, play therapy for children, all these different ways in which we bring mental health services to our folks are not really invested in or even respected. So I always want to lift up those community defined practices. And then when we speak specifically about maternal mental health, there has been a sort of a little bit of folks don't want to fully prioritize Black women when we talk about maternal mental health. But when we talk about, losses in families and, our assembly person talked about, her reproductive journey and that she's had an abortion before, all of those things impact us more on top of the disparities that are already faced. And so we need more prioritization when it comes to mental health in our organizations that support mental health, as well as in screenings. A lot of times, because of our cultural practices and our cultural ways, we're under-screened for different perinatal mood disorders. I have my own story in which a social worker came in and asked me, was I fine after I had a stillbirth? And I told her, yeah. What else am I going to tell her? And that was the end of my journey with getting mental help from the hospital, because I had told the social worker, I'm good. And so, more community-based organizations and people in the community who can be resources, who have this type of mental health training, could have seen me and known she's not good and won't take I'm good as a solution.
Thank you so much, Raina, and thank you for sharing your own story. It's super powerful. I would love to now move on to talk about more deeply opportunities for change, and where you all think those opportunities exist, both at the state level with policy efforts, but then also, as you all mentioned, where those opportunities exist at the community level, where community members are the ones designing and defining the solutions that work for them. So starting with statewide policy solutions, in California, there are a number of what seem to be promising efforts for health equity that would support Black birthing people, mothers, and infants in our state, like the California Black Infant Health Program, the integration of community health workers and doulas into Medi-Cal, home visitors, things like paid family leave, child tax credits, the expansion of Medi-Cal to include 1 year post-pregnancy, a number of other policies and solutions. Alex, this question is for you. The Children's Partnership has had a great fortune of working with you and Alexis and the Preterm Birth Initiative as part of the Whole Child Equity Partnership, and believes that with all of this work that I mentioned happening across California, coordination between prenatal to three agencies, programs, and services like the ones I mentioned is really needed to ensure that policy solutions actually reach the communities that they are intended to serve. Alexis, can you talk to us a little bit more about policy efforts at the state level that you're most excited about when it comes to supporting Black maternal health and infant well-being, and what better coordination looks like for Black communities?
Certainly. So, as my work is really couched inside of maternal health, I was excited when SB 464 was passed, which requires OBGYN providers to take implicit bias training, and for SB 65, which provides Medi-Cal reimbursement for doulas. And I know that there are a number of issues and challenges that still need to be worked out with both of those, but it's a starting point. I personally know how important they are. When I had my last child in 2015, I was refused any pain management medication when I requested it. I was told I didn't look like I was in enough pain, I could handle it, I didn't need it. And in that moment, I was completely robbed of my autonomy and my joy while I was in one of the most vulnerable states, and what should have been a beautiful moment and memory in my life has forever become a memory of terrorism that I faced. that I have to face as a Black woman, regardless of anything else about me. Like, it didn't matter that I'm in this work or that I'm empowered with information and I know how to advocate. I would have benefited greatly if the providers had their biases in check, or if I had a support person in the room that knew what to advocate for. So that's why I'm excited about at least those policies that are being passed as a starting point. I know that there's work being done to improve them and to define what that looks like. Again, wanting to highlight that I know the onus has been placed on Black birthing people for so long to fix this issue. And I'm just glad to see that with policy, we're turning it back on the system to fix itself. And so I'm excited about all the statewide collaborations and coalitions that are forming across the state and attempting to address policy. We're stronger together, right? Like, we can get more done if we all come together and put our heads around it. And we can't solve the problem if we don't know what it is. And the real true problem is anti-Blackness, right? And so better coordination for Black families looks like everybody putting their heads together around recognizing the impacts of anti-Blackness and the impacts it has on Black families and all of us, actually. And then we can create solutions based on that understanding. So, gone are the days where we're going to keep pointing the finger at Black people and say, if you do this, if you do that, when we know what we need to do is dismantle and eradicate anti-Blackness in our programs, our systems, and our institutions. And so I'm super excited about being a part of the whole Child Equity Project, because something the group is doing from the beginning is focusing on recognizing anti-Blackness and its impacts and focusing on pro-Black policies from the beginning. So as we come together and are creating solutions for all families, there's a recognition of the ways in which anti-Blackness is impacting all families and taking into account the unique needs of each of the populations that we're serving. And so I'll leave it at that, but that's what I'm excited about with the whole Child Equity Partnership.
Thank you so much for sharing that. Rhonda, I'd actually like to pass it to you now. So we're in the part of our conversation where we're talking about solutions, and right now specifically policy solutions that we can support and put forward that support Black maternal and infant health and well-being. And Rhonda, I know that a core part of the work at the California Black Health Network is systemic policy advocacy to dismantle anti-Black racism at the state level. We mentioned in our snapshot that we partnered on together, for example, that you all are co-sponsoring along with the California Women's Health Project, Black Health Project, the Health Equity and Racial Justice Fund as a community-centered policy solution to advance health equity. Can you talk more about this fund and any other statewide policy efforts that you all are supporting to advance health equity for California's Black communities?
Yeah, so the Health Equity and Racial Justice Fund is meant to really provide funding and support for community-based organizations, community healthcare centers, tribal communities, to those that are really doing the work on the ground to support communities of color, to improve health outcomes and life expectancy of all our Black and Brown people here in California. Unfortunately, we've been working on this for, I think, going on 2.5, 3 years. And we started out, I believe, at about $300 million. And now I'm not quite sure that, the funding that we need is really there, but trying to get support for this, because it's very important that those of us who need the help and support really can rely on trusted sources and resources that are in our communities, that are easily accessible, who understand what our lived experiences are like, and can provide those direct services as part of that. So we are trying to get that across the finish line, and hopefully Governor Newsom will support it this time around, and hope that third time is the charm for this. But in addition to that, we have what we're doing is actually helping people that are part of our membership network really understand how to amplify their voice around issues that are affecting the Black community. So we started a health equity advocacy training program, which we just completed last week, because we really want people to understand that they do have the opportunity and the right to go visit with their state representatives from their districts. Like the Assemblymember Bonta said, we need to amplify our voices and make some noise and hold people accountable for those that are elected to represent us who may not, again, have that lived experience and know what it's like for us. So, we're trying to continue to advocate for support for the Health Equity and Racial Justice Fund, and stress the importance of, having that direct community connection for relying on resources and direct services to support our communities.
Thank you so much, Rhonda. And now moving to Raina, and kind of going from the state level to the county level. I know that the California Black Women's Health Project is also a co-sponsor of the Health Equity Racial Justice Fund. And as Rhonda said, that fund is really meant to support local efforts in advancing health equity. And one specific Los Angeles County effort that the California Black Women's Health Project is a steering committee member of is the Los Angeles County African American Infant and Mortality Initiative. Can you speak a little bit more about this initiative and the potential specifically of local policy solutions and efforts to advance health equity for Black communities?
Absolutely. So the African American Infant and Maternal Mortality Prevention Initiative is a LA County initiative that is a community government partnership that was really sort of visioned by Black women who live in the most impacted communities, but also worked at the county and recognized that a lot of these interventions were being led by county and government leadership with no impact or leadership from Black people and Black women. And so with that, we came together with the different community-based organizations, throughout Los Angeles, throughout the Antelope Valley, Pasadena, all throughout the county, and make sure that those voices are uplifted, that leadership is uplifted there, that we pay attention to all portions of what is going on in infant and maternal mortality, which includes, we're talking with home visitors, with doulas, with midwives, with the hospitals and hospital associations, all these different levels, and including legislators to come up with some solutions, but make sure that when things are being implemented, that they are Black centered and Black led. And so that is one of the main things about the initiative, and always to move forward with, like Alexis mentioned, always holding up the fact that racism is a root cause of this issue. So we can't spend any more time or investment in changing people's behaviors. That is a large part of what the initiative is about as well. And just lifting leadership up out of the community. I was a part of the South Bay, South LA group, the community action team, and then began working at the county on their perinatal equity initiative and so on. And so there, we have folks like our champion, Holly Mitchell. I was getting ready to say assembly member. My head is all over the place. And working on a bunch of different initiatives to really push, to really put a damper to reduce the disparity and the Black-white gap in infant and maternal mortality. And with some push, I must say, with the power of that initiative, we were able to get things like the board motion, in which they are looking into and investigating the death of a Black woman in my neighborhood, in my community, my local hospital, at Centinela Hospital. And just having that base there and having our champion in the board of supervisors and, always having the collaborative of that group really helps push things like that forward.
Thank you so much, Raina. And that is a good segue to the next part of our conversation, which is really centering community and community voices, experiences, lived experiences in these discussions around solutions. And in our snapshot, we talk about how Black communities have challenged and actively subverted racist structures in healthcare and caring for their own health by utilizing community-defined practices and care that mitigate or eliminate risks to health and well-being, and can also prevent and address health equities impacting children and their families. And Raina, staying with you for a bit, this concept of deferring to communities, I know is a core part of your work and the California Black Women's Health Project. And you talk about the limits to policy and the power of community solutions in a recent article you were interviewed in for Refinery 29. You said, if I can quote you, while policy is important, we have to understand we can take care of ourselves. Community has the solutions. We have ancestral knowledge we can build on. Can you talk more about the role that community ownership plays in closing equity gaps, and how health systems, advocates, and everyone can defer to Black communities to close equity gaps in an authentic and meaningful way?
Absolutely. And I want to say with that quote, I never meant to diminish the power of policy. It is extremely important. But with that said, just as our sister Rhonda mentioned, our governor has not passed that health equity initiative two times in a row. And here we are at another budget and we're begging for these things. So I made that comment to say, while we wait on these policies and continue to push there, we have to really invest in the community, the human resource we have in our community. And we have it there. I mentioned when we talk about mental health, our state departments or maybe our local health departments, mental health departments don't want to invest in the neighborhood, but we can train, which California Black Women Health Project does. We train Black women in the community and give them a mental health one-on-one so that they are a local resource that people can come to when they experience challenges and they may not have a way to a therapist, or they might be on a wait list or whatever. So that is what I mean by really focusing on the human capital that we have. Just like with the same thing that doulas and midwives have been doing before we invested in them, before we had AB 65, they were here. And so we have an opportunity as a community to support community-based organizations and even people that we see in the community that have these expertise and resources. We have another program we have called Emerging Health Leaders. And so we will see people even on community health campuses. They may be talking to people about sex. And we see that is a person who is concerned about sexual and reproductive health. And we would compensate them to continue and expand their work. That's the type of stuff we do here. And that's what I mean by, really elevating community-defined practices.
Thank you so much, Raina. And moving on to Solaire, I know at the center of the work of the California Preterm Birth Initiative also lies a commitment to partnering with those who are disproportionately impacted by preterm birth, which are Black communities. You all utilize a community advisory board as part of your work, and you also have the California Coalition for Black Birth Justice that you mentioned earlier in your opening remarks. Solaire, can you talk a little bit more about the California Coalition for Black Birth Justice, the roadmap to Black birth justice that was just released, and its community-centered recommendations, and really the importance of communities, including community-based grassroots organizations, to address maternal and infant health?
Yes, I can. So the California Coalition for Black Birth Justice, it's really the first of its kind that convenes birth equity and reproductive justice experts to drive coordinated efforts specifically for birth justice for Black families, really connected from Northern California to Central Valley and SoCal. It almost seems a little bit unbelievable that this hasn't been a thing before. It actually came out of some previous work that we did as PTBI with the First Five Center for Children's Policy to assess, the best practices and strategies to address Black infant mortality in California. And after organizing a steering committee with birth equity leaders, after meeting a couple of times, including some folks on this call too, we were kind of wondering to ourselves, why wasn't this happening regularly? Why weren't we always meeting across counties to talk about this, to talk about the solutions that work for our community? That space that we had with that project, with that work, to share, to speak, especially with Black women and birthing people across the state, was incredible. And unfortunately, many of us were and still are working in silos without that support, without that true investment in Black women collaborating to ensure that statewide push for Black birth justice. And so the coalition started with funding from HealthNet to combat just this. And we've been meeting over the last year to develop the Black birth justice agenda, which has a set of priorities that are really going to move the needle and advance Black birth justice in California. We're really excited to release that hopefully this summer, fingers crossed. So please keep an eye out for that. And in the report that we released last year, The Road to Black Birth Justice in California, out of the First Five work, we say, and we've learned through talking with community members, stakeholders, folks that are also working with Black community members, we say that solutions that truly aim to address racial disparities and MCH outcomes must include communities that are most impacted every step of the way. And coalition building and moving solutions with that amount of power is part of that. And so it was in direct response to the work that we were doing. That lived experience is going to absolutely help to guide healthcare systems, help to guide the policy to be more effective. It's going to be more applicable when you have that lived experience at the center. And that is just how we become more effective in our work. There's no other way.
Thank you so much, Solaire. And we only have a little bit of time left in our conversation. So I want to ask one more question to you all before moving to some closing thoughts and sharing calls to action. But Raina, this is actually a question that comes back to what you said around policy and community-defined practices. And I think it is important to highlight that community-defined practices can be turned into statewide policy efforts. And we've seen that come up. You all mentioned the doula movement and a couple other movements where we have seen it is possible. They do not have to live as separate efforts. So Raina, I'd actually love to hear a little bit more from you now, specifically talking about, well, one thing I'd like to mention in terms of where I've seen there's alignment between efforts to include community-defined practices into statewide policy efforts is the work of the California Reparations Task Force. As you all know, they're getting ready. This is an incredible historic task force. They're getting ready to submit their final recommendations to the California legislature in July. They do talk about maternal and infant health inequities that exist impacting Black communities in California, and really put forward some recommendations that seem to seek to integrate community-defined practices into statewide policy efforts. They say one of the recommendations, for example, is to implement Medi-Cal reforms that increase flexibility for the use of community-defined practices that have been designed, tested, and implemented by Black communities, and reduce the tendency to use culturally bankrupt evidence-based practices that do not work and historically have not worked for Black communities. So Raina, I'll start with you. Can you talk a little bit more about the importance of integrating community-defined practices into statewide policy efforts? Where do you think there is the most opportunity to do that in California right now?
I'm like, oh, that's a loaded question. Where do I think that the opportunities are? I think, I believe that we've gotten a really good start with the fact that SB 464 doesn't just talk about the training, but it talks about data, right? And I think one big piece of statewide policy that we can talk about implementing community-defined practices is really looking at disaggregated data and making sure programs across the board, across counties, are looking at the disparity there and then look into the community for the solutions. And if you require that when you look at the disparity and see who's there, and you require those people to be able to give the solutions, I think you really are able to almost require that community-defined practices are implemented. And we've done a good job starting with doulas, how that is, like you said, that's one of our big shining examples, but we need to move even further to midwifery, and we need to move even forward to community midwifery. We've just seen in Texas where, a community midwives recommendations were overstepped and then criminalized the family. So that is a disconnect between our community-defined practices and the hospital and government practice, where we really can make a connection through policy.
Thank you so much, Raina. And I know, Rhonda, your organization has done a lot of work around peers and peer supports, and really the power of peer supports. And that's also a policy area that's being discussed in great depth in California. Rhonda, can you speak a little bit more about the importance of peer networks in advancing health equity?
Yes. So you guys can hear me okay, right? Sorry, I've been having issues with my internet connection here at my hotel. So we started, as I mentioned earlier, the Black Health Network to really provide a space and place where people can come together, no matter where they are across the state, to connect, collaborate, communicate, and network. And hopefully drive some power building, because at the end of the day, right, we're all working towards the same goal. And so I strongly believe that the issues and problems that we're having in our community and the health inequities really is about us, but it has to happen, for us and by us to really drive change, especially at, I think, the local level. And so part of coming together in the peer network for our health network is to connect folks across the state who are doing this work in mental health or healthy aging or even in maternal health, so that, I think someone mentioned this earlier, so that we're not all working in silos, that we're coming together to work collaboratively to come up with solutions, and really to drive change. And again, to kind of uplift the work that everybody's doing and support each other in that. And I think sometimes we feel like our voices may be discounted or silenced or feeling disenfranchised, and we're trying to do our part to change that and really hopefully motivate and empower people to really step up and understand what needs to happen in their communities and be part of driving the change and that transformation that needs to happen. And so we think coming together collectively, collaboratively at the network is one way to make that change happen.
Thank you, Rhonda. And now we only have a few minutes left as part of our conversation. So I would like to ask this question for everybody to answer. But essentially, what can listeners do to support your work and support Black communities, Black mothers, Black birthing people, Black infants? What can listeners do? What is the call to action? And Alexis, we'd love to start with you.
Sorry, I was on a little unmute issue. What can people do? I think in any space you sit in, anywhere you are, if you want to be a part of the solution, is really educating people about anti-Blackness impacts. I'm going to keep highlighting that because I feel like people often don't look at that as the root cause. And in terms of supporting the work that we do, we are super invested in community and making sure that community's at the table. Behind me here on my backdrop is we have a Voices for Birth Justice campaign that was created by community. We uplift voices of advocates and parents and just people who are passionate about this issue. You can check that out at voicesforbirthjustice.com. And if you look on Instagram, it's a number 4. And there's several ways that you can get involved in our campaign and our community events and everything. We're located in San Francisco, Oakland, and Fresno for now, hoping to branch out statewide, but please feel free to reach out to us and we have something that you can do.
Thanks so much, Alexis. Appreciate that. Solaire, pass it to you. What's the call to action? What can listeners do to support all the work that you're doing?
Yeah, I would just say, just to add to what Alexis said, if we really want to see a change, y'all, we have to be bold. We have to be innovative. We have to be willing to be different. And, like we've been sharing this entire time, the game changer is true partnership with the community members that you're working for, not advice or inclusion alone, partnership. It's one of the pillars of doing this work correctly, no matter where you are. So if you care about this issue, you're trying to do something about it, you need to partner with community. And so just one example I'll share, last year we hosted our first annual Hackers for Birth Justice event, which was a hackathon to develop tech solutions for Black maternal health. Folks that are developers, designers in the tech space worked with our community advisory board members to develop tech solutions. So no matter where you sit, even if it's cross-sector, there's something that you can do. That is my call to action.
Thank you so much, Solaire. Raina, would love to hear from you.
I'm going to build on what Solaire was saying because our movement is so vast and we need everybody and everybody has a place. And so one of the things I think about is like, for example, if you're in the health space or you work at a health department or you work in a hospital and you look around you and everybody that's involved in your interventions for Black folks or, tribal folks are white or are not matching that community, it is your responsibility to relinquish some power. It really is. It's your responsibility to make sure you diversify your workforce. It's your responsibility to make sure the people most impacted have leadership. So if you are someone who hires or someone who has influence, that is what you need to do. That is like crucial to our work right now. If you are a policymaker and you are a legislator, you need to be always encouraging your colleagues to be able to feel okay with prioritizing certain folks. There are certain issues that need a priority demographic, and we have to do that, and we can't be afraid of that, and we can't let people sue just because we're not including whatever demographic they're a part of. So I think that's really important, all the way down to if you have artistic talents, we need to be able to spread our message in every type of way. We need people who can help make us beautiful visuals and one pagers that can express this movement in ways that everybody can understand. So we really have a piece for every single body. And if you would even go to any of our websites, I know that our little markers keep popping up. You can click on different programs. There is always ways to get involved. There's always us needing volunteers. There's always us needing voices when we need to go talk to legislators or needing public testimony. So if you want to call me, you can. I got all kind of ways for every single body to get something done. Thank you.
Thank you so much, Raina. And Rhonda.
My call to action would be, really, I talk about how policies influence pretty much everything. And, it impacts our communities with decisions about investment or disinvestment in certain communities, and that all leads to the social determinants of health, which then can create health disparities in many different ways. And so it really pains me when I hear young people say, my vote doesn't matter, my voice doesn't matter. And so I guess my call to action is to make sure that we kind of activate our community to get involved, to get engaged, hold our policymakers accountable, make sure you vote and elect the right people to office that are going to represent your best interest, right? And if you don't participate, it's still, you're still making a decision to not choose the right person or individuals to represent the community and to make sure that, whatever decisions they make or policies that they support are really going to benefit our community and help to advance health equity. So that's what I would say.
Thank you. Well, thank you to each of you for all the incredible work that you do, for sharing your wisdom with us today during this live stream. I'm incredibly inspired by all that you do and all the ways that we can support you all in your efforts to support Black maternal and infant health and well-being. With that, we will close our live stream. And one more quick comment, though, we will definitely be sending all the resources, links to websites that you heard mentioned during today's discussion as a follow-up. Thank you, everyone. Take care and goodbye.
Thank you. Goodbye.
Bye.